Hello, my name is Julian Baker and I wanted to tell you a little bit about what I'm planning for my dissection class for this year. Now, I've been running in-person dissection classes for many years, and then during lockdown, of course, I couldn't run them, but what I started to do was to do some webinars and put some information out there, and this became an opening, as it were, to be able to then run live stream dissections from a lab. And I first did that in the United States. I've carted all the kit out there and ran them, and I did that a couple of times. I've actually really only done it sort of 4 times since then. So what I decided to do this year is to do it so that what I'm going to be doing is recording it through the day and then broadcasting it while I'm there, sort of a joint first time broadcast, if you like, of an evening. And it also means that I can answer questions in the chat while I'm watching it, so I'm not having to stop and answer questions and think about the answers. I can answer those questions in the chat, and then I can also have a bit of time at the end of that broadcast where I can then go into answering any questions. Just switch off the broadcast and put the camera back onto me and I'm not in the lab. So I'm going to be doing it in 3 sections of 3 effectively. So I'm going to do the first workshop is going to be 3 days of the shoulder and the lateral neck. And so I can take out the bits that are long. It means I can focus, I can do a really good job, and I can show you the tissues in the stages of their dissection rather than necessarily you having to watch the whole thing. So again, it's going to be slightly edited so that all that stuff is gone, and I'll be watching it with you. The donors that I'm going to be working with, I have embalmed myself. There's that saying that if you want a job done, then do it yourself. And traditional embalming within university environments tends to use a lot of formalin, which is a chemical that creates quite a strong fix. And these are a lot of the images that you'll see around about and on YouTube, and where there's a lot of they're very dried out, they're quite leathery, and they're not very pliable. And so the system that I use is using a different set of chemicals, and so each donor is embalmed individually, and we put these different chemicals in which give them enough preservation to be able to make sure that they're not going anywhere, but also that there's full mobility. So we have all this movement and mobility in the tissues, and so what you're seeing is it's a lot more lifelike, for want of a better word. Some people will talk about fresh tissue, fresh frozen or unfixed is sometimes used. And again, great, it's no problem, but it's very wet and soft. There's no tone to it, there's no tension to it. And in living tissue, there's always tension. The tension comes from the nervous system being alive, and once that's gone, it's just floppy tissue. So it's not really giving you the range. And so the way that I'm working with these donors is that they will have a little bit of tone and a bit of almost restriction from a full range of movement, but there'll still be full mobility in the tissues, which gives you a really perfect understanding of what's going on. So that's really the plan for this session. As I said, we're going to be doing lateral shoulder and neck, so we'll be looking at the skin, the platysma. Hopefully I'll be able to do that. It's always a questionable dissection because it's so thin, but I'll be able to take some more time with that because people aren't having to look at it live. And then we're going to drop down into the layers of the anterior shoulder, the lateral shoulder, the back, the scapula, the collarbone. And over a space of sort of 3 days, I'm going to show you all the way around through that shoulder and onto that lateral side of the neck, sort of from here downwards. And we can do graded dissections from one side to the other to be able to sort of do comparison and, of course, keep the shoulder joints moving. So by the end of that session, we'll have got down into the deeper structure of the shoulder and around the joints, and we'll be looking at those moving, and it's going to be great. The next workshop is going to be the hamstrings and knee, the sort of down to the just below the knee, and looking at the joint ups. And so there's a lot of continuity that we tend to miss in relation to those structures. So when we're coming down from the hamstrings, they overlap through the knee. Which bits of them come across and join onto the inside of the knee? One thing structure we call a pes anserinus. That's really interesting. We'll have a little look at the sort of iliotibial band and how that wraps and becomes the bag that is encasing the hamstring. So that's again over a space of 3 days of an evening. We'll be broadcasting that out, so you'll be able to see that. And then the final one is the layers of the abdomen, but in this instance how that abdominal tissue relates down into the structures of the lateral pelvis and around, not a massively deep dissection, but round into the lateral pelvis and down into some of the glutes And the reason I want to do that is because I want to again explore this idea of, we talk about core stability and core, and I want to show how the in-depth joining up, if you like, of the abdominal layers is, and what that looks like comparing it from one side to the other. I'll have my handheld microscope, which is amazing. It's just great because it means that we can look at the spaces that we wouldn't normally be able to see. Even if you're in the room, you wouldn't see the depth of those tissues and the spaces that we can get into. I've been doing it long enough now that I know not to have to move cameras around. I've got a great setup that can record all my camera angles at the same time. And so I'll take with me something in the region of 4 or 5 cameras and camera angles plus the microscope, and they'll all be able to sort of show those angles almost at the same time. So it's a really cool way of looking at things, and I can do split screens. And the other thing that really kind of infuriates me a little bit, because you pay for these workshops and you're busy or what have you, and life gets in the way, and suddenly you've only got 2 days to watch it, and then you don't take on board what's going on. There's a huge amount of information. I cannot tell you what 9 hours in one workshop, including your Q&A sessions, are going to cover. There's a huge amount of information, and so that's very hard to take in one hit. So I want to make this available for you to be able to go, in 2 years' time, I'm doing a study on the shoulder or some nerves or what have you, and I'm going to go back and revisit that. So once you purchase access to the classes, then that's it. It's there permanently. So it's permanent lifetime access for the lifetime of the class, the internet, society, civilization, whatever you want to call it. So it's always going to be there for you. If you can't get into the live session again, then don't worry about it, because it'll be a sort of a director's cut. You'll be able to come back to it. You'll be able to see that. It's all laid down, and you'll be able to then see the Q&A sessions as well, which I'll also record at the end of each session. So I'm very excited. I love being in the lab. It's one of those things that 14 hours, as it were, it just flies by. Sometimes I can just be completely engrossed, and I look up and I'm shocked by the time that's gone by. It just disappears. And so to be in that space where I can really focus on the dissection and give a great experience, a learning experience, and talk you through the function and the movement. My stick isn't about teaching you anatomy. It's about showing you the relationships of things. We've got the scapula and the collarbone and the humerus, and there's a relationship between those things, as well as things like the breath. We can't go into everything, but the breath and the neck and the head and how they move around. So I want to talk you through those movements. I'll be moving around the donor that I'm working on as we go to show you the movements. It's all about having a model that you can then take into your clinic that is applicable. It has to be, it's not just a learning anatomy, it has to be something that you can then go literally the next day and help somebody that is alive, as it were, and help them in their pain. And that's really what the motivation is all about. And that's what the motivation of the donors is about. They gave their bodies. They said, when I'm dead, you can have my body, so I don't need it anymore, but go out and benefit other people. And that's really the example of what we're doing. So I hope you're going to join me. I'm really looking forward to it. So see you in there. Come and join me. Gonna be amazing. Second week in July, I think. Anyway, so there we go. If you've got any questions about it, or you're not sure, then please get in touch. Respond to this email wherever you're seeing it. Spread the word. I think it's going to be great. I know it's going to be great because it's bringing all that experience, and each time I do it, there's something new to add, and I'm looking forward to being able to share this with you. So see you in there. Bye for now.